make an upper midline incision in the simulator provided. Deepen that down until the simulated linea alba is demonstrated. A self-retaining retractor may need to be inserted. Pick up the simulated linea alba with 2 clips and then divide with a scalpel down through the linea alba and the peritoneum, ensuring that no damage is done to the underlying bowel, which in this case is represented by a balloon. This will make it immediately apparent should any damage occur. Use firm Mayo scissors to open up the rest of the incision, again making sure that no damage is done to underlying structures. A careful examination should then be undertaken to exclude any adhesions or attachments to the posterior aspect of the abdominal wall. For closure, place a hemostat on both edges of the linea alba, and a further hemostat should be placed at the apex and bottom of the wound to facilitate closure. When closing the abdominal wall, it is vital to use a suture 4 times the length of the wound, with some left over for tying knots at the end. We're going to use a blunt needle for this exercise to avoid the danger of damaging the underlying bowel and to prevent needle stick injury. Start at the apex of the wound from inside out and then from outside in. This will allow the knot to be buried deep to the linea alba. As the suture material is monofilament, it is essential that a well-formed knot with several throws is fashioned. In this case, the first throw is formed in the manner of a surgeon's knot, and then snugged down into position and tightened gently. The apical hemostat is then removed. Following this, 5 to 6 reef knot throws should be fashioned before the end of the suture is cut. The next suture is once again inserted from inside to out, and this has the effect of automatically ensuring the burial of the knot. Carry on down the wound, inserting sutures in a continuous fashion, making good bites and snugging down, but taking care not to strangulate the tissues. Be careful not to drag the needle through the tissue, but rotate it through gently. Once the middle of the wound has been reached, the hemostats can be removed, and the distal end hemostat handed to your assistant. At the apex of the wound, insert the final suture with care, taking trouble to ensure that no damage is done to the underlying structures. The final stitch may be taken beyond the hemostat and the hemostat removed. At the end of this closure, it will be appropriate to use either an Aberdeen knot or a standard instrument-tied reef knot, ensuring that the loop is equilibrated between its 2 strands. Once again, at least 6 ties are required here before the loop is cut. In order to bury the knot, pass the needle through the middle of the wound and out laterally as seen here. And then, as it is pulled, the knot is encouraged to bury itself. The suture material can then be cut flush. In normal circumstances, it may now be appropriate to insert a subcuticular suture. In this case, the use of subcuticular proline is shown using beads to stop the suture material being pulled through. Once the suture has been completed, a bead and its cuff can be applied, slid down, and then crushed with a bead crusher or substantial hemostat.